we can offer a guarantee, and the brand gave us a new implant that will place with no cost.
That's Dr. Gemma. Join us as she answers 4 essential questions every patient must ask before implant surgery in Puerto Vallarta.
What are really implants and when are they required by a patient? How would you explain it?
Well, an implant, it will be, if you're missing a tooth, it will be a good option to replace a tooth without damaging another teeth that are next to it, with that it will be with a bridge. So it's made of titanium. That's the only metal compatible with our body. After that, we need to wait like 4 to 6 months to be able to put a crown on top of that implant and make it work. Before we place an implant, we need to consider patient's health, if they take medication for osteoporosis, if they had any type of chemotherapy treatment or radiation therapy. And also we need to see if implant will function the way the patient is in that moment, and I'm talking about the way they bite, if another teeth are compromised, if we're gonna have a good aesthetic result. So we need to see all that factors before we go with an implant. But basically what an implant helps is to restore a tooth that you've been missing, or all your teeth if you're missing, or basically a bridge over implants. But it can help us to restore your smile. It's one of the best options when the patient is a good candidate for that.
What are other implant procedure types that you offer at the clinic? Do you also do all-in-6, all-in-8?
Yeah, we do all-in-6. We can do, even with 8 implants, we can restore your smile. The only difference, it will be the type of denture that we're gonna use. That is also that we check when the patient takes the CT scan. We need a CT scan to make sure that we have enough bone. We need to take some pictures of the patient, see how their smile is, how the denture will be. It could be just only white, which is just the teeth. We have maybe to combine it with a little bit of pink. So just to see how high their smile is to compensate and make it look natural. So we can work with any type of protocol of implants. Just we need to see what the patient needs, the best option for patients, and if a structure or bone is good enough to do that type of treatment. If not, we can make it happen. The only thing is it's gonna take a little bit longer on the process. Also, sometimes we find out, especially on top, that patients doesn't have enough bone, sinus already collapsed. The surgeon, we do another type of protocol, and the oral surgeon, we work on Zygomatic implants, which is a little bit more invasive, but that's also an option to restore your smile. That type of treatment, to be honest, and just to focus on that, has to be done on hospital because it's a little bit more complicated. I mean, we offer that treatment and we can plan to make it happen.
If you can also share with us what implant brands you normally use.
Yes, I was going to mention, I work with Straumann, which is a Swiss brand, and also another one that it's called Neodent. Those type of implants, you can find abutments, you can find screws, you can find anything to restore the implant any part of the world. It's easier to find the information. Also, the abutments. Also, the other thing is I always share with the patient the type of implant that we use in case a patient is in another country or it's not possible for them to come back. We share all the information so they don't have problems to finish the treatment. Yeah, I always do that.
Excellent. Do they come also with warranties or?
It's a little bit complicated to give a guarantee on dental treatment, okay? Because we don't see what the patient does after they leave the clinic. We take precautions, we give them instructions, but if an implant fails before we put the crown, we can offer a guarantee, and the brand gave us a new implant that will place with no cost. If it's needed a little bit of graft, that may be something that the patient will pay, but the implant itself will have no cost of that. Okay, we need to try to see what the patient did or what made the implant happen, like to fail. Okay, if the patient smokes, that's a high risk. If the patient had, like as I mentioned before, any type of treatment with medicine for osteoporosis, biphosphonates, or radiation therapy. That's something that leads us to make the implant fail. In that case, if it's just a smoking part, obviously the patient has to make the commitment that try to avoid smoking. I know it's not that easy, but they will have to do it. But if it, in terms of any medical treatment like cancer, in that type of complication, we cannot redo the implant because it will not be possible. But besides that, we can offer a guarantee on that type of treatment before the crown. If the implant comes to fail after we place the crown, we'll need to see what makes it fail. If it's something that we did wrong, then we repeat the treatment with no cost. But if it's something that we find out that the patient did, they may have to pay a fraction of the cost of the treatment, just maybe material and lab cost. The other thing that I like to mention on that is we give follow-ups to the patient just to see how they're doing after the treatment. If we indicate to the patient that, we need to see you in 6 months or next winter when you decide to come back, just to make sure everything is okay, in that point we have control of our treatments. But if the patient disappears and then come back after 5 years, we don't have control during those years, so we don't really know what happened. Maybe on that it will be an exception. We will not offer you a guarantee. It is very important for us that the patient let us know anything that happens, like any change. It will be really helpful for us, so we know we are aware of the problem and we can give them a solution without waiting like long period of time. That's also why I gave the patient information of the implant, because if the screw got loose, they can go to an office and they just tighten it and that will be enough without compromising the whole implant. Basically, we will need to just see what made the treatment fail so we can give a solution. If it's also that something that we mentioned to the patient before that it may happen, and even though the patient wanted to do it, then it's not our responsibility. It's really complicated to offer that. It's not like when you go to Costco, you buy something didn't work, you go back and return it. It's not the same. But we do offer, and we are responsible of the treatment if it's something that we did.
Get a great smile with Dentification. Visit a hand-picked dental clinic today.